Sarah, you can go ahead.
Okay. Well, hi, everybody. I'm Sarah Whitledge. I'm an LCSW here in Bowling Green. I work at Marpay Therapy Services. Let me see here. I don't ever use PowerPoint. Hold on. There we go. I've been a therapist for somewhere around 9 or 10 years. I specialize in autism, ADHD, and I also do maternal mental health. So, like postpartum depression and anxiety and psychosis and things like that. Um, the office that I work at, we do mental health, but we also are Michelle P. and SCL providers. So we do behavior supports and person centered coaching, and we have an occupational therapist and a speech therapist. Um, got a couple of pictures of my cats here. so,
They're pretty sick.
so the one on the left is Plop. He doesn't have a tail, and he is just a blob. And then the one on the right is Rasputin, but we call him Raspy, and he's a Maine Coon, just like a fluff monster. Um, so, they're precious babies. And I feel like all of the other cat ladies in the world seem to come to me for therapy. So it works out great. Let's see here. Okay, so I was just going to go over a handful of things today related to COVID and mental health. Let me see if I can move things so I can see better. Okay. Um, so, one of the biggest things to address today is just how COVID has impacted mental health in the United States, and I would also guess across the world. Um, let's see. Sorry, I'm trying to move the camera so I can see everything. Um, so, one aspect of the impact has just been there's been an increase in individuals seeking mental health services. I would say in an average week, I get 10 plus referrals for mental health therapy. I can't take anybody now, but I get referrals nonstop. Before COVID, it was maybe 2 or 3 a week. Now I'm getting like 10 or more. And some states are experiencing a shortage of therapists and mental health professionals. So there are lots of states that have been offering easier ways for therapists to get credentialed with them and to get licensed to kind of like add to that access for people. Some of the other impacts has just been fear, sadness, death and loss, extended time in isolation. Um, and these have also negatively impacted individuals across the globe because, obviously this is a global pandemic that's been affecting everybody. This little chart here just shows the average number of adults reporting symptoms of anxiety and or depression. So on the left, that is from January to June of 2019. That was 11% of people. And so January 21, it's 41.1%. So that's a pretty large jump in people that are experiencing anxiety and depression. And we're definitely seeing a lot of that in the mental health field. And so I was going to ask, what changes have happened for you all throughout the pandemic? Because I know for some people there's been job loss, some people had COVID, some people have lost loved ones to COVID. I think pretty much everybody's experienced some form of isolation and limited access to our activities and things that we like to do. There's been changes in eating habits, relationships, education, loss of housing, food insecurity. So just a little bit of everything. So is there anything that I guess is significant to you all that you all have experienced during COVID that, if we didn't have a global pandemic, probably wouldn't happen?
Isolation, big one.
Yeah.
I think the change in relationships with our consumers too. I mean, not having anybody in the office, not being able to meet in groups, it's taken a toll on everybody.
Definitely. Yeah, I know I've got a lot of people that, I used to see in person all the time. I would see them every week in person. I haven't seen them in person in like a year and a half now. And that's really weird. And now I have these relationships with people through the computer, which is also really weird. But, it's working somehow. Let's see. So, some signs and symptoms of stress. And I got all of this from the CDC. Feelings of fear, anger, sadness, worry, numbness, or frustration. I feel like that feeling of fear was probably way more prevalent in the beginning of COVID when we didn't know anything and it was all new and nobody knew what was happening. But then I'm going to guess that that's also kind of coming back now, because as this next wave of COVID is kind of like increasing cases again, I'm going to guess that fear is coming back. Changes in appetite, energy, desires and interest, difficulty concentrating and making decisions, difficulty sleeping, nightmares. And then, we could also have physical reactions like headaches, body pain, stomach problems, skin issues, worsening of chronic health problems, worsening of mental health conditions, and then increased use of alcohol, tobacco, and other substances. Because if you think about it, we've been stuck in our houses, and I think one industry that did really well during COVID has been the alcohol industry, because, well, what else are people going to do? And so, there's been a lot of issues for people that are also just bringing up the need for, oh yeah, maybe I should go get a therapist. Maybe I should find somebody to help me with these things. Let's see here. So I just put a couple of images on here, just some basic things about anxiety and depression, because I think I have a lot of people that come to me and I'll ask them, like, are they depressed or are you anxious? And they'll be like, no, I don't think so. But then when I start to go through the symptoms, they're like, oh, that's what that is. So with anxiety, that can just be our overthinking, avoiding things, sweating, stomach issues, panic attacks, needing reassurance from others, our lack of patience, constant worrying, procrastination, which I'm really good at, trouble breathing, headaches, rapid heartbeat, insomnia, and memory issues. And I think a lot of people also don't realize that with anxiety, sometimes that looks like anger, and it looks like being impatient or being really irritable, when really it could just be that we're really anxious. And then for depression, some of our symptoms are also anger and other anxiety, poor focus, lack of energy, isolation, issues with our sleep and our appetite, or if we're not interested in the things that we used to like to do, that's a really big indicator for depression. And so, some treatment options might be, just trying to get active, doing hobbies, eating better, getting rest, and in some cases, looking at getting medicine. Let's see here. Okay. So some ways to cope with our stress, because I think everybody's experienced probably a significant amount of stress in the last year and a half. So taking breaks from watching, reading, or listening to news. And that includes social media, anything that we have that's like spewing all the news at us all the time, taking a break from that. Because, if we are constantly bombarded with all the negative things that are happening in the world, then that makes everything seem negative and terrible. So if we can take a break from some of that, or even just limit it by, like, say, I'm only going to check the news app or Facebook or whatever for like this many minutes once a day. So kind of limiting that access so that we're not constantly bombarded with it. Taking care of your body, so deep breaths, stretch, meditate, eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, avoid excessive alcohol, tobacco, or substance use, continue with routine preventative measures, and that might mean also getting the vaccine, and then get vaccinated. And so, I think with taking care of our body, I know what I've noticed over the last year and a half, it was a lot of what I've been telling people to do is make sure that they're eating, make sure that they're sleeping, and that they're getting plenty of water and getting outside. Because vitamin D deficiencies have been really like prevalent with people, and vitamin D deficiency can also kind of mimic depression. And so when we're not getting outside and we're not doing stuff, then that vitamin D can get really low. And, it's really a pretty kind of easy fix to get a supplement to help get that back up so that we can feel better. Like, have any of you all struggled with vitamin D deficiency? Because I feel like a lot of people have.
I was just diagnosed with it, actually.
Yeah. So, and I've had a lot of clients that vitamin D was just really low. And once they got on like that weekly supplement and then like a daily supplement, it's like night and day. Like they feel so much better. And if you think about some of our, you know, clients that we work with and the families that we work with, that they haven't had maybe adult day programs, they haven't had jobs to go to, they haven't had any of these places to go, things to do. We've been stuck in our houses doing nothing, where there's no natural sunlight and there's no being around other people or anything. So our vitamin D and things like that can get pretty low. Let's see here, make time to unwind. So try to do some other activities that you enjoy, connect with others. So whether that be actually going to see somebody or texting, FaceTime, Zoom, whatever, trying to find time to interact with other people. Because I know that's what helped a lot of people get through COVID, is just being able to talk to somebody and being able to recognize that, like, I do need social interaction. And then connect with your community or faith-based organization. You know, once people were able to kind of get back into like groups that they go to or church services and things like that, like you could tell like almost an immediate difference in their anxiety and depression. It was like almost like this weight was lifted off where we were able to go back and see people again. Some other coping strategies would be like grounding. And I've got an image there for grounding. So grounding is looking at your five senses. So let's say that we get overwhelmed with, I don't know, COVID. So thinking about COVID and just like going down that spiral of all the what ifs. So if we can use grounding, that will help us kind of get back on track. So looking for 5 things that you can see, 4 that you can feel, 3 that you can hear, 2 that you can smell, and 1 that you can taste. And so by the time we get through those, our mind is off of whatever it was. And we've moved our attention onto something else so that we can get through it and we can be okay. And so what I always like to say is, like, once you get to the last one, then taking a big deep breath and being like, okay, I'm all right. I can do this. What do I need to do next? So then having in mind the next thing that we're going to do so that we are not allowing ourselves to kind of get distracted on all of those what ifs. And then coloring, drawing, crafting, listening to music, deep breathing, exercise and yoga. And exercise and yoga, I know some people are like, yoga's stupid, but yoga can be really helpful because it helps us stop and think and focus on our body and focus on our breathing. Because when you're doing yoga, you can't think about other stuff because you got to think about where you're moving your arm or your leg, or if you're breathing the right way, and you don't get the opportunity to think about everything else. And I put on here also the Calm Harm app. That is an app that was originally designed for teenagers that self-harm, but it's super helpful for basically anybody that just needs a way to be distracted. And so on the Calm Harm app, it has a bunch of different categories. And when you're in the app, it will give you just random things to do. And so some of the random things to do might be name as many Harry Potter characters as you can, count backwards from 100 by 17s, listen to your favorite song, or write down as many songs that you can think of that start with the letter S, or it's just random stuff. But the purpose is to get your mind off of everything else and put it onto something different. And then by the time you get through the little activities it gives you, then you can choose to do more, or you can say like, I'm fine now and I'm done with it. And so that's super helpful for a lot of reasons. So I always recommend that one. And then we could always call a friend or a loved one or get a change of scenery, just trying to find something to do to kind of like redirect us away from things and kind of just get our thoughts off of whatever it is. So do you all use any of these coping strategies already?
Yes. I listen to music and I color and draw sometimes.
Mm-hmm.
And listen, I'm always listening to music, and then I try to deep breathe too. That helps.
Yeah.
Because I'm having trouble with anxiety.
Mm-hmm.
You know, my heart's beating too fast, and I try not to think how to get calmed down. You know.
Well, and that grounding can help a lot. Because once you, basically by the time you get to the end of that and you take a big deep breath, you'll feel your heartbeat go down. And I have an Apple Watch. And so every now and then, like if I'm feeling anxious and I notice my heartbeat is out of control, I will do like the breathing app on my Apple Watch, and it just like tells me to breathe, and it tells me like, inhale and exhale, and then it tells you to stop. And then by the time I'm done with that, I'll go back and look at my heart rate, and it's lowered by like 10, 20 beats or whatever. And you could also just work on your breathing and look at the heart rate app on there and see like, oh yeah, it is going down just by me breathing. So yeah, the deep breathing is a really big one. Let's see. So how to get back to a pre-COVID life. Number one, and I know this is, some people don't want to get it, but I'm going to say get vaccinated because that's going to help so much. I know for me personally, as soon as I got the vaccine, I felt like this weight lifted off of me of like, I can be around people now and I don't have to worry so much. I can get out of my house and not have to be worried if, I'm going to catch whatever. And I had COVID and I don't want it again. Start saying yes when asked to go out with friends and family, because if we're feeling depressed, it's really easy to say no. It's really easy to say no and be like, nah, I'm just going to hang out here. It's easier to do this. If we start saying yes, we can see that like, oh yeah, I do enjoy those things. And I really do like hanging out with people and doing things. Find the places and activities that you liked to do before and try them out again. Because I know a lot of places closed and some of them are still closed or maybe not opening again, but like trying to just gradually get back into things that we did. Like one of our biggest things was being able to go to the Hot Rods games. Like before COVID, we would go to like at least a game a week every time they were in town. And so now we had a whole season of none of that. So it's really exciting to just be able to go do that again. Find ways to keep yourself active and busy. Invite friends over as long as they're, safe and reasonable. And then get out of your house and exercise. Because exercise goes a long way, especially if we're doing things outside. We're out in the sun, we're moving, we can't think about other stuff, and we're getting some energy out. Because that's also going to help with our sleep and everything. Let's see. So when should we try to start therapy? Anytime. And I always tell people that like, sorry, therapy can be a preventative measure and shouldn't just be viewed as a like, I don't feel like I need it yet. Because I feel like if we could go to therapy before it's like a crisis situation, then we could deal with things a little bit better and be able to feel more confident in addressing situations. Therapy can be a great outlet to get assistance with anxiety, depression, grief, etc. It can also be a great way to learn new skills, and a therapist is an unbiased individual who helps you make changes and improvements in your day-to-day life. So you all, whoever wants therapy can call anytime to set up an appointment. And I put on here how to find therapy. So, it used to be that there were only like community mental health centers and things like that. But now there's a lot of like small private practices and just more opportunities available. And there's also a lot of online options. So we can look at websites like Psychology Today and Mental Health Match. Mental Health Match is kind of cool because it actually like has you enter in information about like religion and like your views on things. And it also kind of helps match you with the therapist in that regard. So maybe like rapport would be easier to build. And then local resources like the Center for Accessible Living or the Community Mental Health Center, can try to connect you with things or get you set up with somebody. So it's super easy. Pick a therapist, give them a call or an email, get an appointment, get therapy. There are a lot of therapists right now, though, that do have waiting lists, and it can be kind of difficult at this current time because everybody's so full. All of the schedules are full. But I've been trying my best to reply back to everybody or call everybody back and say, hey, I can't see you, but here's somebody that can, and try to get them with somebody that could see them as soon as possible. And then the benefits of telehealth, it expands access, saves time, shortens delays, eases stigma, and it may be more comfortable. I've had people that it's really difficult to talk in person, but as soon as we started telehealth, it was like I had a whole other person I was talking to because it was so much more comfortable and just easy because they were in their house, they were in their room, and they could say all the things without any worry. So do you all have questions? And if not, then I have a cool slide that says thank you. But I hope that that was helpful information. And I know, yeah, just accessing therapy, I feel like a lot of people look at that as like this daunting task or feel like they have to have a referral or whatever, but really you can just call a therapist and say, hey, can you see me? And if they've got if they have the availability and they take your insurance, then great. If they don't, hopefully they will help redirect you to somebody that can. Oops. So I'm going to stop. There we go. Okay. So yeah. So do you all need anything else from me?
Are you doing good now? You said you had COVID. I hate to hear that.
Oh, I had COVID in my quarantine ended Christmas Eve.
Wow.
And so I had like a mild case, knock on something. My husband had it really bad and he lost like 15 pounds and it was just, he had a hard time. But since then, knock on something, we've been okay. We both got the vaccine as soon as possible. Yeah.
I'm glad you're both doing well.
Yeah. Thank you.
You're thankful.
Yeah. And I'm back to almost strictly telehealth with the rise in cases. I only have like maybe 5 or 6 people that come in person.
That makes sense.
And the only ones that come in are vaccinated.
Right.
Yeah.
I don't blame you.
Yeah.
This was very helpful. Thank you for
Well,
having it
you're
for
welcome.
us.
Yeah. And if
Very
y'all ever have any questions or need anything, you can always call, text, or email. And I'm more than happy to help with whatever. And I can send you all that PowerPoint if you need it.
That was
Yeah, if you would send that to me, that'd be great, Sarah.
Sure. Yep. I'll send that here in just a minute.
Okay, thank you so much.
Well, you're welcome, but I have a client here in a minute. So I will see you all sometime. Have a good day. And